but before they could kind of be successful for that, he took his own life.
What's the craziest problem you've seen?
So it was an unfortunate story where a guy had just gotten married and him and his wife were trying to have a baby, but before they could kind of be successful for that, he took his own life. And he was in the ICU on life support. So they called us and they said they're gonna pull him off life support, but before they do that, they want his sperm.
What's the most good vitamin people can take to keep themselves, like for a woman or for a male?
We have a lot of things that we look at, it's important that, vitamins are important, but just like everything in medicine, too much is not always too good. So, it's always important that if you're taking something to better understand why you're taking it and make sure that a healthcare provider is aware so they can better guide you.
Almost the same exact vitamins that I give my guys. Guys need folate, guys need CoQ10, which is very important for sperm production. Another one is zinc. Zinc is really important.
Hey guys, on today's episode Beyond the Chair is gonna be with Dr. Mahdi Bazzi, urologist, specialist with testosterone and men infertility. And Dr. Ali Bazzi, one of the most amazing doctor and fertility doctor, so it's amazing combo. Dr. Mahdi, what does urologist do?
So urologist treats disorders of the urinary tract, starting all the way from the kidney and the adrenal glands, going down to the bladder, and we also treat male reproductive organs like the prostate, penis, and testicles.
Mahdi also specializes in male fertility. So as you remember, we had a very nice session about female infertility and what we do from a female perspective, but then also Mahdi is kind of my counterpart and works with male fertility. So we work with each other a lot.
Yeah, so I'm a urologist by training, and then I did fellowship in Houston for a year, focusing on male infertility, testosterone therapy, and sexual medicine.
So sometimes what happens is when I get the patients, a lot of times when I get couples, the male and the female, or sometimes the male that comes to see me, we start off with a sperm test or semen analysis. And if the test comes back not normal or abnormal, a lot of times I call on specialists like Dr. Mahdi Bazzi to further evaluate the male so that we can combine the treatment and help the couple to have a baby.
So what's the most common problem men come to you?
So some of the most common things guys come in to see a urologist for are pertain to the prostate. So prostate enlargement, elevated PSA, which can be an indicator for prostate cancer, which is one of the most common cancers that men can get. And then some of the younger guys can come in for things like infertility, and kidney stones is another big one that we see a lot of.
So other question, what age men should come visit you? Is that like certain age or doesn't matter?
Well, that's a good question. When it comes to prostate health, typically we see guys coming in their 50s. What's recommended that if you're 45 and you have a family member with prostate cancer, then you should probably get your PSA checked and maybe see a urologist. And if you don't have a family member with prostate cancer, then you should start checking at 50 years old. But we see guys of all ages. I see young adolescents, I see older guys, I see basically a very wide range of ages.
Yeah, so sometimes, I'll get men who are in their 20s or 30s or even 40s or 50s who want to check their fertility or are trying to, have a baby with their partner. And at all age groups, they come in, they do their semen analysis, they do a sperm test, and if things are not normal, then we go ahead and we work together. Dr. Mahdi Bazzi and I work together to try to figure out what's wrong so that we can help them to eventually conceive and have a kid. Right. So all age group, it really depends on what age group they're coming in, whether they want to check their fertility or if they want to assess things like their prostate and so forth.
How you like it, Doc?
Awesome, thank you, Chief.
You're welcome.
So yeah, like Dr. Bazzi was saying, I see patients from a very young age trying to come in for fertility consult. And one of the unique things about the field of infertility is it's a couple's disease. Most conditions where you're treating one person, and infertility you're treating two people.
So what's the difference between kidney stone and bladder stone?
So honestly, it's just the location of the stone. Most stones in the urinary tract form in the kidney. That's why they're called kidney stones. But they can travel down the kidney and get stuck in the ureter, and sometimes that's when people have a lot of pain and go to the emergency room. Or they can pass them and it goes into their bladder. Now there are guys that come in with big prostates who aren't able to empty their bladders well, and they can form stones in their bladder.
Okay, I think that question, a lot of people, they need help from both of you guys, especially like guys they married. What's the good number for a female and what's the good number for a male to have a baby?
Okay.
Yeah, so in Dr. Mahdi Bazzi's world, as long as the men produce testosterone and sperm, they can pretty much, for the most part, have kids. For the female parts, that's unfortunately not the case. We know that as a woman ages, the egg count, so the egg count and the quality of the egg both decrease. So the number of eggs decreases, as well as the amount of eggs that are genetically normal. So it's more of a time issue for the female components, but there's also a time issue as well with the male components in certain situations, right?
Yeah, that's true. So if you have a good fertility doctor like Dr. Bazzi, he just needs one sperm. But for guys, you look at different things. So if a guy's trying to conceive naturally, typically the magic number for sperm, and you can correct me if I'm wrong, is about 15 million moving healthy sperms. So when a guy comes in, a semen analysis is one thing I definitely look at. You look at the number of sperms, you look at how many are moving, that tells you how many of the sperms are alive. And you look at the semen, which is the actual liquid that comes out in the ejaculate, that holds nutrients for the sperm. And we also look at their hormones too. Testosterone plays a big role in sperm production. Testosterone, the testicle has two functions, making testosterone and making sperm. So the testosterone has to have a rich environment of, the testicle rather has to have a rich environment of testosterone in order to have adequate sperm production. Now when you go down the line of assisted reproductive techniques, depending on which one you're choosing, guys can have lower numbers.
So you brought up the testosterone. Mm-hmm. I did a lot of deep research about the microplastic. As it affect, I mean, I'm sure it's affect. Does it affect the testosterone?
It definitely does. So when we've done like longitudinal studies looking at just the general population and looking at guys' semen analysis numbers, so guys' sperm numbers over the last few decades, globally we've seen a big decline in sperm numbers. And one of the theories for that is microplastics. Now things you find in microplastics are things like PVC, which can disrupt something called the testicular blood barrier, the testes blood barrier. So the testicle has to be in a protected environment because you have a lot of germ cells in there, which are precursors to sperm cells. And your own immune system can attack the sperm cells. So the testicle has a natural barrier, just like the brain does, that does not allow anything in or out. PVCs and microplastics can disrupt that barrier.
Wow.
And that can affect testicular health. So you see lower testosterone numbers, which is another thing we see globally, where guys are having lower numbers over time, and it can affect sperm production. And then the other thing that you could see in microplastics is BPA. BPA is a small molecule that can act as like an estrogen. And for men, men do need some estrogen for a lot of functions, but if it gets to a very high number, then that can affect your testosterone production, that can affect your sperm production. So your body can, these things mimic estrogens and can go on receptors tricking your body into thinking your estrogen levels are high. They can kind of turn off your testosterone production and your sperm production.
So correct me on that. Is it the microplastic and make the oxygen whatever high, right?
So that's
The free radicals.
The free radicals, which can harm your testicle.
Yes, because I read about it. That's why I want to make sure about these.
And hormones, it's all a balancing game. Your body's trying to balance your hormones. Your body's trying to, so your brain communicates with your testicle, sends signals to your testicle saying, hey, you need to make testosterone. And when it gets to a certain number, your body senses that, and your brain, and that signal goes back to your brain saying, okay, stop sending the signals, we have enough. And when you introduce things like microplastics, that can disrupt this balance.
Man, if you've seen it now, like everything in plastic.
Yeah, I mean, most Americans consume water through plastics. A lot of the food is packaged in plastics. It's sort of hard to avoid.
I swear to God, Doc, like, I mean, I'm not born here. Back home, like when I used to be a kid, bro, we drink water from the river. Like straight from the river.
Yeah.
Nothing happened to us. We don't get sick. We don't have any problem.
Yeah.
But now, look, all that plastic and everything, and you still get sick and worse than...
Yeah, and now it's more of a global problem. Like I said, you see globally, testosterone levels are dropping, sperm numbers are dropping, rates of infertility are very high.
Yeah, and I see this a lot in the clinic too. I get a lot of men that come in and they just want to check their fertility, get a semen analysis, and a great proportion, a good number of patients come back with something from their semen analysis that's not normal and that's low, and they're surprised. And they start asking, like, what am I doing wrong? Is it what I'm eating? Is it what I'm consuming? Is it my activities? Is it smoking? Is it supplements in the gym? There's so many things that go into it. This is why, we say that if you have any issues or concerns, it's good to get checked out just to make sure.
Now, I have a question for you. How often do you have men walk in who aren't married, aren't trying to conceive, and then just want to check their fertility status?
Yeah, for one reason or another, they want to check because they have future plans that they want to focus on in a year, 5 years. Sometimes they just want to check because they're doing what Barbara Teeve's doing. They're doing research and they get worried.
Yes.
And they just want to know. It's just for them to learn more about their body, their health, because just like everything in medicine, or for the most part, almost everything in medicine, the earlier you find out, the earlier you know, a lot more can happen if you prepare and you know in advance. So I do get a lot of men who come in and just say, I just want to get a semen analysis. I want to understand what I'm doing wrong, if I'm doing anything wrong.
Well, the reason why I asked that is everyone knows that semen analysis is a good measure of your fertility, how fertile you are. But there's a lot of strong studies that show guys who have an abnormal semen analysis are more likely to die at an earlier age, and they're more likely to develop cancers at an earlier age, like certain cancers like prostate cancer and colon cancer. So a semen analysis could be an indicator of your overall health. Something is going on in your testicle, but I think that indicates usually a genetic problem, because genetics also, besides the environment, definitely, like microplastics, they definitely play a role in your testosterone and sperm productions. But genetics is also a strong role.
I think it played a big role.
Yeah.
Because I seen, like I have a client and I talk to them. You know why I called you and I called Mahdi? Bro, I have like clients, they struggling with that.
Yeah.
They really struggling.
Yeah.
So I love to do this podcast,
Definitely. Yeah.
Help a lot of people.
If we can do anything, if we can at least just bring insight and knowledge and just make you feel, help you gain more knowledge about the process, that's great. If this makes you want to ask more questions and learn more and take the extra step to see someone like Dr. Bazzi or see someone like myself to do fertility, that's a step forward, and we want to make that easy for you.
There's a lot of anxiety around it, for sure. And that's one of the reasons I kind of subspecialized into men's health. When I first went into urology, I wanted to treat prostate cancer and urological cancers like kidney and bladder, and that's kind of what drew me to urology, seeing all the cool robotic surgeries. And but in my residency, when I started seeing patients who come in for infertility or sexual dysfunctions like erectile dysfunction, you see, or low testosterone, you see the anxiety that comes with it too.
Yeah, I'm in the same thing as you. I was interested in gynecologic cancer and treating cancers of the female reproductive tract. But then I started seeing, what huge impact you can make pretty quickly just by knowledge for couples with infertility and help them really bring life into this world, right? At the end of the day, this is what we do. At the end of the day, our goal, what I want, and I know that's what you want because you've told me several times, is we want to help couples achieve, the joys and beautiful wonders of having kids and starting a family.
Yeah, for sure.
Is it kidney stone common more in men or women, or doesn't matter?
Well, both men and women can get kidney stones, and there's a lot of factors that put you at risk for kidney stones. Part of it's genetic, so if you have family members who have kidney stones, you're more likely to get it. But the biggest thing is water intake. So being dehydrated puts you at a higher risk for kidney stones. And even your environment. There's an area in the U.S. they call the Stone Belt, and that's like Florida and some of the southern states.
Too humid.
Where it's too humid, yeah, and people tend to be more dehydrated and form more kidney stones.
I think some of the the unique things of what we're when people come to us with fertility, time is important, especially for the female. And also, like Dr. Bazzi was saying, the anxiety, the stress, it's tough. It's tough to have to wait a month, 2 months, 4 months, 6 months, even 1 week. What we try to do is we want to try to help so that to get you in not only sooner, but evaluated even quicker. And that's kind of the approach we've been able to do and work with one another. I was able to, refer quickly to you, you refer quickly to me, and get the patients in and get them treated, because we understand not only is it, physically tough on the body, but mentally it's really, really challenging. So this is kind of the model that individuals like myself and Dr. Bazzi are trying to develop, this new kind of boutique-like style model to really put the patient at the front and help them get treated faster and seen faster.
Mm-hmm. Did the women get urinary problems like a man?
So women do get urinary problems, and it's a little different than men. So it's more common for women to get a UTI because their urethra is shorter. So it's easier for bacteria to travel up. And that's where most of their urinary problems come from. Or after vaginal delivery, some of the muscular structures around the bladder can kind of get weakened, and that can cause some urinary issues. But when we're seeing, what we see on the guy's side is once you get into your 40s, 50s, 60s, the prostate naturally enlarges over time. And depending on how it enlarges, it's basically plumbing. And if your pipes are smaller, it's going to be harder for you to pee. And some guys have overgrowth of their prostate inwards, and they have to apply more pressure to empty their bladders. And those are the types of problems we see in guys. Then when it comes to kidney stones, it's pretty much the same with guys and girls, or the approach to it.
So now in the world, like a lot of infection, mm-hmm. especially between men and women, mm-hmm. about the STD, all the infection. I don't know how many, to be honest, because it's a lot of them. But a lot of people get sick because of that.
So I see two main types of infection. I see urinary tract infections, and the problem in that world now is antibiotic resistance. We're seeing more and more like superbugs that are coming that are resistant to so many of the classic antibiotics we use to treat bacteria, and that came about from us kind of over-treating infections, and over time these bacteria became genetically modified and they're able to resist some of the antibiotics that we normally hit them with. When it comes to STDs, those typically come from unsafe sex practices or having sex with multiple partners, and that can also play a role in your fertility. Really, any infection or inflammation of the urinary tract can affect your sperm production.
Wow. What about the STD?
Yeah.
So, is it because of a girl, like she sleep with multiple men?
Or it could be from a guy sleeping with multiple partners, yeah.
Oh,
Yeah.
so it comes from both ways.
It comes from both ways. Yeah, it's
Okay.
not. It's not from.
So we talked
It's
about-
not one-sided.
We talked about the testosterone.
Yeah.
How can you build low testosterone high naturally, like not pills?
Right. So I get that question a lot in clinic. How can I naturally bring up my testosterone?
Because you're
So-
specialist with that, so
Right,
that's what
yeah.
I'm asking.
So testosterone, what's the function of testosterone? We talked about its function in fertility. The other function is how you feel. Okay, it has a lot of what we call androgenic effects, where it gives you energy, sex drive, motivation, your ability to concentrate, and it has some anabolic effects, helps build muscle. And you know what is, they call it like the fountain of youth, getting testosterone. But besides having those functions, it's also important for your overall health. Studies show that guys that have a lower testosterone, die at earlier ages, are higher risk for obesity, higher risk for developing diabetes and heart disease. So when I see guys coming in for low testosterone and they ask, how can I naturally bring it up? The first question I think of is, why is your testosterone low? Some of the more common reasons I see is being overweight. When you're overweight, your fat cells convert a lot of the testosterone you're making into estrogen, so you can't use it.
Wow.
So for guys like that, the natural way to bring up their testosterone is to lose weight. Other things that have been shown to increase your testosterone naturally is endurance exercises, strength exercises, like cardio or weightlifting, at least a moderate amount, can increase your testosterone naturally. Healthy sleep cycles will help you increase your natural testosterone, because testosterone kind of follows your circadian rhythm. Guys see a peak of their testosterone in the mornings, and it kind of drops during the day.
Go low.
Yeah. So having good sleep habits can help you improve your testosterone. And then stress levels, which is sometimes hard to control.
Yes.
When you're very stressed, you have a different hormone that rises called cortisol, and that kind of competes with the testosterone and inhibits testosterone production. So those are all ways you can kind of try to increase your testosterone naturally. And there's some herbs you could take, like ashwagandha or mucuna, and those can have some mild increase in your testosterone. But you know, a lot of these effects can only increase your testosterone so much. So we see guys usually 20 to 30%, and for a lot of guys that's enough, you know. But you do see guys on the lower end where that's not enough for them, or it's hard for them to go exercise. It's hard for them to go to the gym. They're not motivated because their testosterone is low. They can't get up and exercise because their energy levels are low. And for guys like that, that's when you talk about medical treatment for testosterone, or testosterone therapy, where you just kind of give a guy testosterone in injection form or pill form, or like a cream, and that can kind of increase their testosterone.
But is that gonna affect him in the long run or no?
So it depends. Anything you take in medicine can have effects, right? Now,
That's why I hate medicine. We talked
And-
about it a lot.
And so there are medicines where you could take a medicine like Clomid, for example. I know you use Clomids for your female patients, but you could use it for guys too, where it kind of tricks the body into thinking the testosterone is even lower than what it is, and then your body starts to overproduce it. And that's a medicine, and that can have side effects.
That one has side effects.
Yeah, of
too?
course. And then
What kind of side effects?
so I think common side effects with Clomid could be headaches or and nausea. Am I missing a big one?
Nausea,
Blurry vision, I think, is extremely rare, but
hot flashes.
hot flashes, yeah.
Mood disorder, a little bit. So.
And then I have a lot of guys who just take testosterone. So they take synthetic testosterone, which is different. It's still the same hormone that you naturally produce, except it has like a different ester chain on it, and it's made in the lab. Now, when you take testosterone, exogenous testosterone, it can decrease your sperm counts because your body thinks that it has enough testosterone, so it shuts off the testicle. It says, we don't need you to work right now. We have enough testosterone. So the testicle doesn't need to make any testosterone.
Yeah,
but what that can do is also turn off your sperm production. Now, more recently, there are ways to kind of counteract that, where you can give guys things like HCG to keep the testicle on while they're on testosterone.
But it's like kind of, I don't know, it doesn't make sense to me. So if you have low testosterone,
Yeah.
your sperm count is gonna be low,
Yeah.
right? Or not necessary.
Yeah, if you have low testosterone, so like I was saying before, the testicle needs testosterone to make sperm.
So when you take testosterone and your testosterone high, like you take an injection or
Yeah.
same the bodybuilder, like how they take it, how it drop the
That's a very
sperm
good. That's a
count?
very good question. So when you take testosterone, remember earlier I was talking about the testicle protecting itself and making
Yes.
a testicle blood barrier.
Yeah.
The testosterone you're taking cannot penetrate into the testicle. Can go everywhere in your body, but it can't get into the testicle.
not used for the sperm
Okay.
production that you need.
Okay. They use it for muscles or energy and
So yeah, it can go to your muscle tissue, it can go to your all your other organs, but it can't penetrate the testicle. So your testicle needs about 50,000 to 100,000 times the amount of testosterone that your body needs to make sperm.
is
So
that?
even whatever you're injecting even if it were to penetrate, it probably wouldn't be enough.
So is that when you take testosterone is gonna affect your like sperm count in the long run?
Definitely, yeah.
Which
Definitely.
way?
So the way it happens is when you take testosterone. Earlier I was telling you about your brain sending signals to your testicle to kind of turn on. Your brain senses you taking the testosterone from an outside source. So that signal that's going to your testicle saying, hey, you got to make sperm, you got to make testosterone is off.
So in certain situations, like, and I'm sure you've seen this, in a certain situation, if you keep taking testosterone for a long time, it can cause permanent damage, correct?
So it can possibly, most of the time, if guys stop taking testosterone,
It's gonna build up?
it comes back. Yeah. So what you're seeing is just the testicle kind of turning off, but you rarely see any like scar tissue formation in the testicle. But for some guys, if they've been taking it for a really long time, it could be up to 3 years.
Yeah.
And those guys probably need assistance where the signals that are supposed to come from the brain, you can also give those as medicines. And you kind of give the guy medicines and it's kind of overstimulating the testicle to kind of turn back on.
You know what's funny? I'm asking you that question because I have one of my client. He's kind of my high. Little bigger than me.
Okay.
Bro, he started taking testosterone. Bro, this guy turned to a gorilla. Literally, even his head got big. I swear to God, I'm not like, I'm saying that everybody knows
Yeah.
about him. And then how much he started taking testosterone was one nerve here. His hand, he can't close it no more. And it started shaking, like it goes up to here and stop. So when he went to the doctor, he told him, you gotta stop doing that. Literally a month after he stopped like do the testosterone, this guy came literally like a stick.
Yeah. So I see guys like that.
But it's crazy drop.
A lot of times it's not testosterone that guys like that are on, but it's more testosterone derivatives that are anabolic steroids.
He does
Yeah.
with testosterone more stuff like pills, all that, like not just testosterone. And then he did checked his testosterone. He was, I think, 900. It dropped to 210.
Yeah.
He can't even move.
Yeah.
Like when he came to the shop like this, bro, he's sick. Bro, what happened? He said 1, 2, 3 because I did that 1, 2.
Yeah. Then you have all the side effects of having low testosterone, like low energy, depression.
But see, that's the most important thing. Like, if you're going to take medicine, any medicine in general, especially even something like testosterone, it's important that somebody that's experienced with it sees and knows and gives you the right, not only the dosage, but also follows up to make sure that you're doing everything healthy for yourself, because you don't want issues in the long term.
My patients who are on testosterone have to come in regularly and get a lot of things monitored, like their blood pressure, their cholesterol levels, their estrogen levels, make sure that's not getting too high. And then if guys want to have kids, then we have a whole different conversation. But if you're kind of doing that on your own and you're overdosing yourself, that's when you can run into a lot of trouble.
Wow. It's for both. Like, what's the most good vitamin people can take to keep themselves, like for a woman or for a male?
Men's health.
Yeah, we have a lot of things that we look at. It's important that vitamins are important, but just like everything in medicine, too much is not always too good. So, it's always important that if you're taking something, to better understand why you're taking it and make sure that a healthcare provider is aware so they can better guide you. But some of the things we look at is like in the prenatal vitamins, a lot of them have things like folic acid. They have things like vitamin D, other important vitamins as well. They have things like, especially in women who, need that little extra boost for their egg count or the quality of the egg, things like CoQ10 or DHEA. So all these things can be, taken with moderation, as long as you're following up with your doctor, depending on your case and your situation and what your goal is, can be given to you and prescribed and monitored as you take them.
Yeah.
What about Ben?
It's almost the same exact vitamins that I give my guys.
Prenatal?
Yeah. Well, guys need folate. Guys need CoQ10, which is very important for sperm production. Another one is zinc. Zinc is really important for testosterone production and for sperm production. Vitamin D, vitamin C, omegas are very important as well. Yeah.
Because the thing is, the same signals that go from the brain to the pituitary gland, to the hypothalamus in the brain, to the pituitary gland, and then they go all the way down to either the ovaries or the testes. These are the same hormones. These are the same hormones that Dr. Bazzi and I evaluate the patients for and treat. And so vitamins that may help with this system that I'm telling you about can be used for both of us.
What's the craziest problem you've seen in male infertility?
The craziest fertility story.
Yeah.
So when I was in fellowship, I did something called a post-mortem orchiectomy. And it was
I don't know what is that,
so
but
it was a crazy story. So it was an unfortunate story where a guy had just gotten married, and him and his wife were trying to have a baby, but before they could kind of be successful for that, he took his own life. And he was in the ICU on life support, and there was documented proof that they were trying to conceive. They saw fertility doctors and they were trying to do everything they can. So they called us and they said they're gonna pull him off life support, but before they do that, they want his sperm. So we had to go to the ICU and get sperm from his testicle, so with the family's approval, of course, so they could use that for IVF.
To have a baby, yeah.
Yeah, but we had to take the sperm and lock it in a sperm bank, because there's a lot of legal issues and a lot of legal hurdles that they have to jump through after. I mean, it's a very difficult situation because the ethics of it, and do you really know what they wanted, and there's a lot that goes into it. But if I don't take the sperm at least 24 to 48 hours after death, then most of the sperm cells are gonna die. So my job was to take the sperm and preserve it, and then they can kind of go through the legal hurdles of trying to retrieve that sperm for IVF.
What?
Yeah.
Did the guy pass away?
The guy had passed away, yeah.
And is it like his wife pregnancy wasn't successful?
I don't know what happened after that, because it was towards the end of my fellowship, and that's when I moved back to Michigan, but I honestly don't know what happened after.
Is that in Houston?
Yeah, it was in Houston.
Wow. What about, Doc, about you? What's the craziest?
I think the craziest story I've had is a patient who seen four or five infertility doctors throughout the state and outside of the state, and had a lot of problems. Issues with the tubes, issue with the uterus, had many times where they were doing IVF. And really, I think what the biggest challenge for her is you need to step away for a little bit, evaluate the whole picture, look at the whole story, It's not just one problem. If it's multiple problems, connect the dots, fix each problem, systematically go back, make sure everything's okay, and prepare her, give her the best shot to get pregnant. And I think why it's such a crazy story for me, or like a story I always remember, is just because I was able to see how all the years of hard work and the toughness and the struggles she went through, just to see this patient light up and completely change, completely new person. It just brought so much joy. It gave her a new outlook in life. And it reminded me why I do what I do every single day.
Man, you guys saving lives, bro.
It's so important to step back and look at a patient as a whole, like he was saying. I can't even count the number of times where I see guys who have had low testosterone, went and got testosterone prescribed, and they were taking it, but no one ever looked at why this guy's testosterone was low. And I found guys with like pituitary tumors in their brain that was kind of overlooked because people saw he has low testosterone and the answer is just to give him testosterone and let him go about his day. Or someone has some fertility issue and they kind of narrow their focus on just that, and instead of kind of stepping back and looking at the whole patient or why they're at where they are, you can kind of lose focus of what to do or what's right for the patient.
I want to ask you that question because I seen one video on Facebook. What is that, like the shots you guys give to the woman to let her get, like, I don't know, more eggs or?
Yeah. So it's the shot we're given. You're probably referring to the IVF medication that we do. A couple of the shots, the common ones are, we call them recombinant FSH, and then another medication that has both FSH and LH. So these are the same hormones that Dr. Bazzi and I were telling you about that get sent from your brain to your pituitary gland, to your ovaries or your testicles, the FSH and LH. So what we're doing is we're giving them a big hefty dose of what your body naturally produces anyway. So by giving you a big hefty dose, it's telling your ovaries, it's pushing your ovaries and it's telling your ovaries produce as many eggs as you can and help these eggs grow, so that when it comes down to something like IVF, we go in there and we suction out and we take all those eggs. So it's doing what your body naturally does every month, but at a higher dosage of the medication.
When did you use that?
We use it a lot for, most commonly used for things like IVF or in vitro fertilization. But in some couples who have tried other medications, they may opt to do stronger medications like those injections you're saying for things like timed intercourse or even IUI, insemination. So you can use it for different treatment plans, but most commonly they're used for things like IVF.
But like my point, is it a number to make you like think, oh, now I gotta use that shot?
I think it's more so, and this is kind of the approach we're trying to bring on to our practice, is a personalized approach, one-on-one. We don't want to group every patient and say every patient does this. We want to take each patient, get to know each patient, become really one with understanding what the patient's going through, and then focus the plan on the patient. So going back to your question, it all comes down to what we've done for the patient so far. What have we tried? What's worked? What's not? What has not worked? And then also talking to the patient, giving the patient the decision-making capacity to say, this is what I want to do. Work with the patient. So it's a combination of what's in the patient's history, what's worked, what hasn't worked, and then also what the patient wants that can determine when to use it. But for example, if the patient's been trying for years and years and years, natural way to get pregnant, having intercourse that's not working, then you might talk to the patient of using some medications like you're talking about. You might talk to the patient saying, let's do something like IUI or IVF.
Again, what is the prostate and why it's important?
So the prostate is an organ that's right below the bladder, and its main function is to create the semen, which is the liquid that you see when you ejaculate. And the semen has minerals and vitamins that nourish the sperm in order to keep it alive and healthy, so that when it enters the vaginal canal and goes up the uterus, it's healthy enough to kind of penetrate into the egg and fertilize it. So the main function of the prostate is a fertility function.
And I seen that. I told you about the guy, like he's trying. He has, I don't know, you see that vein, the one always pop.
Varicocele?
Yeah, from your like feet, or some people on the arm, or did they have some on the prostate? Or
Well, varicoceles are in the scrotum. And that's one of the most common reasons some guys are infertile. So what a varicocele is they're dilated veins. You know, you have blood coming into your testicle through an artery and leaving through a network of veins. And it's a very delicate function where the veins kind of exchange, they have like a counter current exchange with the artery, with the blood going in and blood coming out, to make sure that the testicle is about 2 degrees Celsius cooler than the rest of your body, because that's where it optimally functions. Now when a guy has a varicocele or dilated veins, it can disrupt that counter current heat exchange. And it can also have backflow of reactive oxidative radicals, and that can disrupt sperm production. So there are times that those veins need to be treated in order for sperm or for testicular health and for the sperm counts to kind of come back up. Not in every guy. So varicoceles are very common. Yeah. One in 6 guys out in the general public have a varicocele. Yeah. Not everyone has infertility from a varicocele, but it is one of the most common things we see in the office.
And depending on what grade the varicocele is, sometimes what happens is, like, you know, if the partner is trying to with their wife or girlfriend or whoever trying to get pregnant, if their varicocele is a low grade varicocele, a lot of times what Dr. Bazzi would do is he'll say, let your partner get checked by, you know, someone like myself, a fertility doctor. If everything comes back normal, then you'd be more inclined to treat that. Whereas if there's something more abnormal from the female partner, and they have a low grade varicocele, you may or may not treat it, correct?
Yeah. I look at what it's doing to the sperm counts. Yeah. So if someone comes in with a varicocele and their sperm counts are completely normal and their hormone levels are normal, then there's nothing to do about it. It's not dangerous. But if it's affecting your sperm levels, then it's worth treating. But I always tell patients' partners to go get evaluated as well. Like I was saying before, it's a couples disease. And in the US, 1 in 8 couples suffer from infertility.
Wow.
About 25% of the time, it's a male factor. About 25%, it's a female factor. And 50% of the time, it's both male and female factors. So it's very important that the partner is also being evaluated to make sure any barriers to their fertility is being addressed.
Doc, my main thing on this podcast, to be honest, was the testosterone. Mm-hmm. A lot of people struggle with testosterone. That's the reason, like, I called you.
Yeah.
Can you tell us, like, a lot of information about it?
Yeah. So testosterone, you know, helps you feel good, improves your energy concentration, you know, and it's an important indication of where you are health-wise. You know, guys with lower testosterone are at higher risk for other diseases. Now, testosterone can be taken very safely. You know, if all the right things are monitored, if you understand all the risks when it comes to fertility and what things you could do to address what happens with the infertility and testosterone, then it can be taken very safely.
What made you go Pacific, like, to be specialized?
In testosterone?
Yes.
So there was 3 things I wanted to do for patients. I wanted to help them have kids. That's why I specialize in infertility. I wanted to help guys feel better, and that's why I went into hormone therapy. And I wanted guys to be able to have sex for their entire lifespan. And that's why I went into sexual medicine.
You talked to me earlier about, you know, some people when they get older, they not into sex no more. You told me about surgery. I don't know what it is.
Prosthetic implants?
Yes.
So sex is a big part of a man's identity. The ability to have sex, the ability to have erections. plays a role into someone's identity. And then just because someone is a certain age doesn't mean they shouldn't have sex anymore. You know, you have your lifespan, which is how long you live.
Yeah.
And you have your health span, which is as long as you're alive, you're healthy. You know, if you want to live to 80, but you also want to be healthy throughout those years. And one of my fellowship directors, Dr. Mohit Kara, came up with a term called sex span. So as long as you're alive, you also want to be able to engage in sex. So when it comes to sexual medicine, you know, one of the main focus, but it's not the only focus, is erections, you know. And there's different treatments for erectile dysfunction. There's Viagra and Cialis, which most people know about, but those are pills that can help improve the blood flow to your...
But is these gonna affect you a lot?
So, they can have side effects, yeah, like headaches and back pain. But the thing is, when it comes to erectile dysfunction, there's a lot of things that can cause erectile dysfunctions. One of them is poor blood flow to the penis. And what these drugs do is they kind of help dilate your blood vessels and improve blood flow into the penis. And I think Cialis also can help with your prostate health. It improves good blood flow to your prostate. And a lot of guys even take it as like a pre-workout because it naturally increases your nitric oxide, so you have better like vascularity and better blood delivered. There's better blood flow to your muscles when you work out and better nutrient delivery. But that's essentially what these drugs are doing. They're expanding your blood vessels, allowing more blood to come into the penis, and which leads to the erection. Now, for some guys, these drugs stop working, and mostly because their vascular disease is so advanced. So options for them are injections, where you inject drugs directly into the penis to stimulate an erection, and those drugs work very well, but they do have a high dropout rate because a lot of guys don't like working with needles. So the kind of last line of therapy is getting an implant. And just like how women can get breast implants, men can get implants in their penis.
What?
Yeah. And it's all internal. You know, you do surgery, we put the implant in the penis, and when they want to have sex, they almost have like a third testicle. And they inflate it, and they have a hard erection, they have sex, and then they deflate it. And look, from the outside, you wouldn't be able to tell what's happening there. And unless like your partner's a urologist, she may not be able to tell that what you have is an implant. But and there's other forms of newer forms of treatment for erectile dysfunction too. There's shockwave therapy. Shockwave therapy kind of helps stimulate new blood vessels, or grow new blood vessels in your penis, so you can get stronger erections. That way, if you don't like taking pills or you don't like taking medicines, that's another option for you.
Man, I appreciate you, Doc, for coming. I appreciate Dr. Ali.
Yeah, I want to join and hang out with you guys.
I appreciate it. It was amazing.
Yeah.
To be honest, like a lot of people struggle and they like kind of shy to talk about these stuff and they don't know what to do.
Yeah.
So, especially testosterone, that's the main thing.
Yeah. I think testosterone, you know, fertility, sexual dysfunction, it's hard to bring up.
Yeah.
Yes.
You know?
Yes.
It's not easy saying, I'm having fertility issues. I need to see.
I'm telling you, like I have literally 3 guys. I send them to you. Like literally they shy.
Yeah.
So when I did the first podcast with Dr. Ali, by themselves, hey Tief, man, we've been trying like 5-6 years.
Yeah.
Bro, just go to this guy.
And it's hard for guys too. Sometimes, you know, a lot girls talk to each other.
Right.
You know, I feel like most girls are more comfortable talking about fertility.
Yes.
When it comes to guys, you and your best friend could be going through the same issue, and you'll never know.
100%. How I met Dr. Ali, I know Hassan Shukr, he's a doctor too. Big shout out to Hassan Shukr. I love you, bro. So I told him, man, I need a doctor, like any doctor, I need to do podcast with this week.
Yeah.
He said, you know, I have my cousin.
Yeah. He's a great guy. I learn from him all the time.
He's an amazing guy.
All the time.
He's an amazing
I
guy.
have his number on speed dial.
I mean, literally, we did this podcast together today, but we've been speaking to each other all day today. So we're really helping our patients get in sooner, get in the best treatment. And, you know, we want them to see us and then move on and enjoy their life. And we're really trying to help people do that. Male and female.
Big shout out to both doctors. If you have any issue, I hope not, check Dr. Mahdi Bazzi or Ali Bazzi. I mean, they same last name, so both of them amazing. If you guys need any question, drop it down. We're gonna make it happen for you. His office, like it's in Livonia. What street?
Michigan Fertility Institute, 14815 Farmington Road in Livonia.
And Dr. Mahdi Bazzi, he's in West Bloomfield.
Yeah, I have an office in West Bloomfield, Troy, and Utica.
Make it easy for you. Peace out. Thank you for watching. Appreciate you guys.
Thank you.